Do you get muscle cramps and immediately try to squeeze your calf hard? Stop right there. There is a simple trick that is 10 times more effective, yet very few people know about it. A muscle cramp is a sudden, strong, and painful muscle contraction that causes the muscle to stiffen, making it impossible to move for a few seconds to several minutes. It is most common in the calves, thighs, feet, hands, and abdominal muscles. This condition happens most often during sleep, after exercise, or due to prolonged sitting or standing, dehydration, or mineral deficiency. Symptoms: when a cramp strikes, you will feel a sharp, intense pain in the muscle. The muscle becomes tight and locked up, making it difficult or impossible to move the affected area. So, what are the common causes of muscle cramps? Muscle fatigue, overexertion, or a sedentary lifestyle can both cause cramps because they disrupt the muscle's contraction and relaxation function, leading to involuntary spasms. This is mainly due to lactic acid buildup or because muscles are under prolonged tension without rest, interrupting neuromuscular signals. Dehydration and electrolyte deficiency, potassium, sodium, calcium, magnesium. This is a major cause because these minerals affect muscle contraction and nerve transmission. An imbalance in electrolyte levels leads to sudden, uncontrolled muscle spasms. Specifically, water maintains balance, potassium and magnesium regulate muscle relaxation, while sodium and calcium are essential for contraction. When deficient, this coordination is disrupted, making muscles prone to twitching, fatigue, and numbness. Posture: sitting or standing for too long or curling your legs while sleeping causes cramps by reducing blood circulation and causing oxygen deprivation, forcing muscles to remain contracted for long periods. This overstimulates the neuromuscular system, causing sudden spasms when you try to move slightly. Other factors: pregnancy, aging, medication side effects, chronic diseases, tight shoes, and temperature changes. Here are the most effective tips to relieve muscle cramps. When you have cramps in your toes, step 1. First, use your palm to bend your toes backward while simultaneously flexing your ankle up and down. Perform this movement until the cramping in the toes subsides. Step 2. Next, use your thumb and index finger to gently pull and stretch the cramped toes. Doing this helps stimulate blood circulation to the cramped area. When you have a cramp in your calf, step 1. First, pull your foot towards your knee. This action stretches the cramped muscle in the calf. Continue this movement until the cramping decreases. Step 2. Next, use your thumb to press with moderate force into the center of the back of the lower leg. This spot is the midpoint on the line connecting the Achilles tendon and the back of the knee. Step 3. For the next move, use your thumb to press into the center of the calf muscle belly. This position is the midpoint between the spot you just pressed and the back of the knee. Step 4. After that, use your thumb to stroke firmly behind the ankle bone, moving either upwards or downwards. Step 5. The next point to target is use your thumb to press into the center of the back of the knee pit. Step 6. Finally, gently massage and rub the calf area to ensure blood circulation. When you have a cramp in your arm, handle it as follows. Step 1. Straighten the affected arm, then bend your palm backward so it is perpendicular to the arm. Use your other hand to apply a stretching force to the cramped hand, pulling it back towards your shoulder. Keep applying this pressure until the cramping subsides. Step 2. Next, use your non-cramped hand to massage the armpit area of the affected arm. This action helps push blood and promotes rapid circulation to the cramped area of the arm. Step 3. Finally, massage the cramped part of the arm with moderate force. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.